talk about the coronavirus. People are worried. Internal medicine specialist Dr. Darrin D'Agostino from Kansas City University is with us today, helping us separate fact from fiction. You get asked a lot of questions about this.
I do.
Let's just begin with what it is. What is the coronavirus?
Coronavirus actually has been around for a long time. As a matter of fact, some of the earliest evidence shows it's been around since 8000 BC.
You said it's the common cold. It's the same thing.
It's one of the viruses that gives us the common cold, but a few of the coronaviruses, as they've changed, have come from animal reservoirs into the human population. We saw that happen in 2003 with the SARS virus. And this is a cousin of, or a very close relative of, that SARS virus.
All right, so what is our risk of being exposed to the coronavirus? And, what's our chance of actually getting that sickness? Because we can be exposed but not get sick.
Yeah, first, it's important to say that the CDC, the World Health Organization, and most public health systems in every country are really heightened right now about this. In the United States, our risk is very low to get it. And the reason that is because of all of the efforts that are happening around the world and also our travel restrictions that have occurred. The Chinese have put severe restrictions on travel out of the country, and for the first time this morning it was announced that the rate of infection is starting to see a dip, which we haven't seen since it was first identified in December.
So when we talk about 71,000 people have the coronavirus and some are being brought to hospitals, what's the safety precaution at the hospitals to prevent other people at the hospital or in that community from getting it?
So this virus is spread through droplets, and that means as you cough or sneeze, you have to take precautions that those don't get on surfaces that you're touching or get on your face or that you're inhaling them. So droplet precautions that are going on in the hospital are usually done by isolating that patient in a room that has negative flow air, so it takes the air out, brings in fresh air from the outside, and oftentimes scrubs the air so that you don't have a problem. In the common world where we all live, it means following a few of the things that you learned when you were in kindergarten. Cover up when you sneeze and cough, wash your hands often, and if you're sick, stay home so you're not coughing on people.
So when we talk about the coronavirus having an economic impact, I mean, people are really, the fear in people, they're starting not to do certain things, to go to certain, places, restaurants and businesses and those kinds of things. Is that the fear that you're trying to dispel here? What do you say is the fear we need to?
I am. It's very important that we have the correct information. So we talked about the 71,000 people that are infected with COVID-19, but we're really not talking about the 26 million people that are infected with influenza. And when we talk about the number of hospitalizations for COVID-19, about 11,000, 12,000 people now, those numbers are still coming in. We compare that to 250,000 people with flu. So flu is much more prevalent. It's much more likely that we'll get the flu, and we have to take those same precautions, those droplet precautions, make sure that you're washing your hands. I recommend to all of my patients, my students at the university, we're teaching our students how to deal with these types of infections and how to protect themselves. It means washing your hands, covering up when you sneeze and cough, and making sure that you're not transmitting.
So flu virus more concerning to you than the coronavirus right now? Just
in the United States, that is the one we have to worry about. Right now, there have been about 14,000 deaths due to flu. That estimate is probably going to go up closer to 36,000 before this season is ending.
This flu season, which started December...
It started in October.
Oh, okay.
And this flu season itself has already seen a large number of deaths due to the flu. So although coronavirus is something we have to pay attention to, and it is an aggressive virus and you can catch it, in the United States it's very low. There are only a few states that actually have cases. Those cases have been isolated. The public health system is wrapping itself around those people that have the infection, and our healthcare providers are very aware of it. But if you haven't gotten your flu shot, make sure you're getting that, because in the United States, it's more likely you'll get the flu than you will coronavirus.
All good information. Thanks so much for coming and for sharing and helping us separate fact from fiction and making us more aware of be concerned about the flu. Make sure you're practicing healthy safety tips.
Thank you.
Thanks for coming. We'll be right back.